Hello friends, family, and patients. I wanted to give you an update on the COVID-19 pandemic and how it's affecting orthodontists in Florida, including our practice. So on March 21st, Friday, March 21st, the governor of Florida sent out a mandate to all dental and medical practices and saying that all non-urgent, non-emergency procedures be postponed until May 8th. So basically they're saying unless the patient needs to go to the emergency because of pain or infection, we are prohibited by law to be able to see those patients. So the good thing is that most orthodontic practices don't have a lot of emergencies. And we're going to be here to take care of any emergencies that you do have throughout this whole process. The reason why the mandate came out is because of the lack of personal protective equipment, PPE, you might have heard that in the news, the gloves, the masks, the gowns. There's not enough for the hospitals, especially in the areas hardest hit, and so they don't want any medical and dental offices using those supplies when they could be used during the pandemic for the hospitals that need them. So that's why the governor sent out the mandate, and that's why they basically eliminated all elective treatment for dental and medical needs. So I'm going to start with some other positives. One positive is that most orthodontic practice offices and most orthodontic patients do not have emergencies. Number two is, if you are in braces, don't worry, your treatment will continue. The teeth will continue to move with the wires and the braces during this time, even though we're having to postpone your treatment for a few weeks or a month. Also, if you're in Invisalign, and even if you're on your last tray, your teeth and your roots will continue to move into the proper position during that time. Just keep wearing them until we see you and reschedule your appointment. So, I also know that it is disappointing for the people that were about to get their braces off. There is a silver lining though, is that by having your teeth in this really good position and keeping them there for a month or 2 months will help reduce the chances of relapse once we get them off. It'll make it more stable, it'll help the bone and everything form around the teeth, so there is a silver lining in that case. And we will get you in as soon as we're allowed, and if it's sooner, we will call you to make sure that we can get them in to get those braces off too. Some really important things to remember: please keep brushing your teeth. Since you aren't able to have your routine dental cleanings, and we are able to check them, especially those teenagers, they need to be able to brush their teeth 2 to 3 times a day. Really take care of them so that you don't get any cavities or those white spots. Also, be extra precautious if you are out of braces with your retainers. I would like to say just wear them at night. Make sure to reduce the chances of being lost. Make sure that you keep them in a case away from any animals when you don't have them in your mouth, because if you do lose them, as of right now, we are not allowed to see you to replace the retainers. So please keep a close eye on your retainers. Make sure you don't lose them. If there's an issue with them, you can send us a text. I'm going to provide you a cell phone number, and also we'll have people answering the phone at the office, and you can contact by social media to see what we can do to get you by. If the teeth do happen to move, don't worry, we will take care of them. We will get them back to where they need to be and make sure that you have that beautiful smile. So I want to make sure you know that we are here for you, and we're setting up the ability to do some virtual consults and be able to talk to patients through video chat to make sure that their treatment is progressing, especially the ones that have appliances in or that are wearing elastics. And we'll also be reaching out to reschedule the appointments that have been postponed and make sure that everybody continues to get the care they need. We are here for you, and I want to make sure that we will be sending out other notifications and videos in the future to make sure that we keep in contact with everybody. So please stay patient, stay diligent, and keep smiling.